This is the promised land.
I think it's generally recognized that we have the worst health care fraud in the country here in South Florida.
Kendall Coffey, U.S. Attorney for South Florida, says that up to $2 billion a year is being stolen from Medicare, just in his area.
You make it sound like what Willie Sutton said about banks, that's where the money is.
That's exactly right. It's sort of like, for criminals, a field of dreams. If the money is there, they will come.
We heard about an elaborate scam in which clinics are now recruiting Medicare patients to help them steal from the government. We came to Miami to investigate. We started hearing from people in the poorer sections of Miami. The drivers routinely patrol these areas. Welfare offices, senior centers, even street corners, asking Medicare patients to come with them for checkups in return for cash. So we spent several weeks getting ourselves plugged into that network.
I didn't like the idea of them ripping Medicare off, because I feel like if they continue to rip Medicare off, there's not going to be any Medicare.
To get plugged in, we enlisted Lizzie Green, a 75-year-old widow who lives on Social Security and a small pension. She agreed to be our undercover test patient.
I figured, well, this is a way that I might be able to help get something done about it.
Next, we started making contacts in Liberty City, a poor section of Miami where drivers can find people who have a Medicare card and need some extra cash. Soon, we were put in touch with this man, who called himself Creole.
That's what I'm saying. Now, I got people already to the clinic. When I go pick up 2 more, 3 more people, I just sit there and wait. I don't go nowhere until you get finished.
One morning, he picked up Lizzie and PrimeTime associate producer Sale Sutherland, posing as a friend and wearing a hidden camera. Creole gave Lizzie instructions, which he would also hear from other drivers, to give vague symptoms so doctors could order any test they wanted.
What did they tell you?
They would say, tell them you have a shortness of breath, and something like that, or tell them your chest hurts.
Creole took us to this clinic called Northwest Medical.
Hit that door for me.
It looked like he helped run the place, even taking other patients' Medicare card through the window.
Yeah, see.
When it was time to see the doctor, Jose Valiente, we had Lizzie ignore Creole's instructions to give vague symptoms and instead give one specific complaint she actually has, pain in her knees from arthritis. But Dr. Valiente still ordered an electrocardiogram and a breath test, sending Medicare a diagnosis that she had respiratory abnormalities and heart murmurs. But we'd already had Lizzie examined by 2 well-known Miami doctors, Pedro Greer and his son, Joe. The son is the founder of Camila's House, which provides free treatment for Miami's homeless.
How would you generally characterize her health?
For her age, very good.
No big health problems?
Not from my perspective as a physician.
But from Dr. Valiente's perspective, it was enough to bill Medicare for $665 in tests. By the way, take a good look at the doctor. Later, you'll learn something about his identity. After Lizzie was through, Creole paid her $50, a kickback that, in the Medicare program, is a felony. And he gave producer Sutherland an open invitation.
Don't forget, you said if you got somebody else that want to go, let me know.
Another clinic we visited, the Miramar Medical Center, went much further with unnecessary tests.
My knees hurt.
Again, Lizzie had only one complaint, but Dr. Vina Lopez kept asking about other symptoms. Numbness in the hands, chest discomfort.
No.
What about shortness of breath or colds? Despite saying her only problem was with her knees, Lizzie was given a breath test, an EKG, and a battery of blood work. Weeks later, we learned the clinic had billed Medicare for more than $1,400, including a $900 test for allergies. We asked Dr. Greer if there was any justification.
Would you give her an EKG?
No, she doesn't need one. She's not complaining of anything like that.
Would you give her breath test?
The spirometer? No.
Would you give her a $900 allergy test?
No, I wouldn't. Not a $900 allergy test.
Jean Demergent is an assistant U.S. attorney for South Florida.
Couldn't it have been that she walks into a clinic, she's a new patient, so they want to give her a thorough checkup?
No, Medicare does not pay for checkups. Medicare does not pay for preventive medicine. Medicare pays for the treatment of a specific diagnosed illness.
We told Lizzie about one more test the clinic had ordered.
I don't want to get too personal here.
Mm-hmm.
They also charge for a blood test for syphilis.
Oh, my God. Oh, no.
You bet.
I never had anything like that in my life. I've never no kind of diseases.
What did you go in there complaining about?
My knees.
But when you sit and don't say nothing, they love that.
One of the other patients, who was driven from Miramar with Lizzie, said he was a regular there.
If they pay you the first time you come here, you get paid the second time you come here. The third time you come here. Each time you step feet inside there, you sign John Henry or whatever wise, you get paid for that.
He was right. Lizzie was paid $100. While some people may have gone to these clinics for real health problems, many seem to be part of the scam. This woman said if Lizzie didn't take all the tests, she wouldn't get paid. In all, we went with 4 different drivers who gave Lizzie a total of $470 in kickbacks. Sometimes she went in a van packed with professional patients, and the drill was always the same.
Basically the same as the other place.
Okay.
You know, you're sick. Just don't say you're not.
Vilma explained drivers pay patients out of what they get from the clinics. She said it's a good living.
Some days it be very well. Some days I might clear $500 or $600.
But that's nothing compared to what the clinics make, getting paid by Medicare for any claims they submit.
We've seen a lot of them go in and go out of business in 6 to 9 months and make anywhere from $250,000, $750,000.
So far, Lizzie had visited 2 clinics, and the bill to Medicare was more than $2,100. But when she went to another clinic called Technocure, things really got expensive. She spent the whole day there, and business was booming. The waiting room was packed. There was even a lunch wagon outside. Lizzie's doctor was Jaime Verhel. Once again, she said her only problem was knee pain. He never once even touched her, but he said, remember, Medicare does not pay for checkups. But over the next several hours, Lizzie had a laundry list of tests. Echocardiogram, EKG, Doppler, nerve conduction. They even put this woman with knee pain on a treadmill. And Medicare got the bill. Almost $4,000 worth of tests. How could they charge that much?
What they generally will do, notwithstanding whatever the patient says, they'll put down that the diagnosis is chest pain or some ailment such as that, which would justify those kinds of tests.
The diagnoses from Technocure included chronic obstructive asthma and rheumatic aortic insufficiency, medical conditions which Lizzie did not complain about or have. At the end of her visit, Lizzie got $100. The Technocure still wasn't through. A few weeks later, a medical technician showed up at her apartment with this. Remember the diagnosis of asthma? That was on a separate bill for this inhaler called a nebulizer. Medicare is being billed $340 a month for it.
Have you ever once used this nebulizer?
Never. The only time this nebulizer was used, he set it up to show me how to set it up.
And since then?
It has not been touched. I put it back in the box, and that's where it's been sitting.
That makes our running total so far, visits to 3 clinics, $6,746 in Medicare bills. Whenever Lizzie went to a clinic, the first thing they do is take her Medicare card, or red, white, and blue as it's known on the street. Because they know that once you have that Medicare number,
You can bill thousands and thousands and thousands of dollars. You can bill for a series of tests this month, and 6 months later, using that same number, you can come back and bill again.
and we found that some clinics bill even if you don't come back. Lizzie visited Northwest Medical on March 2nd and had a series of tests. But Medicare was also billed for follow-up visits and more tests on March 18th and 21st, a total of $545. The problem is, Lizzie never went back to Northwest, never had those tests. Across town at the Bicentennial Clinic, there was almost no relationship between what they did and what they billed Medicare for. The doctor's name is Miguel Gonzalez, and once again, Lizzie had only one complaint.
My knees.
Now, watch the total physical exam that Dr. Gonzalez gives her. Just a few seconds leaning over his desk, touching first one knee and then the other. And that's it. He never touches her again. The doctor then pressed for more problems: diabetes, anemia, coughing.
The knees is what hurt.
When Lizzie stuck with her one complaint, the doctor seemed exasperated. He sent her next door to a radiology clinic for an x-ray. That was all they did. A slow day for Lizzie, but it turns out a profitable day for Bicentennial.
They diagnosed